Welcome back. Today we're discussing antisocial personality disorder. To start, what exactly is antisocial personality disorder?
Antisocial personality disorder, often shortened to ASPD, is a mental health condition in which a person consistently shows a pattern of ignoring or violating the rights of others. People with this condition may struggle to follow social rules, take responsibility for their actions, or show empathy toward others. Their behavior often appears reckless, manipulative, or dishonest. It's important to understand that this disorder is not simply about being quiet or avoiding social situations. Sometimes the word antisocial can be confusing. In everyday language, people use it to describe someone who prefers to be alone. However, in psychology, antisocial personality disorder refers to a deeper behavioral pattern involving disregard for social norms and other people's well-being. Individuals with this condition may repeatedly break rules, lie to get what they want, or take advantage of others without feeling much guilt afterward. These behaviors usually appear during adolescence and continue into adulthood.
So, when does this pattern usually begin to appear?
The roots of this disorder often appear early in life. Many individuals who later develop antisocial personality disorder show signs of conduct problems during childhood or teenage years. For example, they might repeatedly get into trouble, ignore authority figures, or behave aggressively toward others. However, it's important not to jump to conclusions. Many teenagers occasionally break rules or behave impulsively. What separates normal teenage behavior from a clinical disorder is the consistency and severity of the pattern. Mental health professionals typically look for long-term behaviors, such as persistent lying, physical aggression, lack of remorse, and repeated problems with the law. These patterns must continue into adulthood before a diagnosis is usually considered.
What causes antisocial personality disorder? Is it mainly genetic or environmental?
The causes are complex and usually involve a combination of biological and environmental factors. Research suggests that genetics may increase the likelihood of developing certain personality traits, such as impulsivity or a reduced emotional response to other people's distress. At the same time, environmental influences also play a significant role. For instance, children who grow up in unstable environments, where there is neglect, abuse, or inconsistent discipline, may struggle to develop healthy emotional and social skills. Another factor involves brain development. Some studies suggest that certain brain areas responsible for decision-making, impulse control, and empathy may function differently in people with antisocial traits. So, rather than pointing to a single cause, it's better to think of the disorder as the result of multiple factors that build up over time and shape behavior patterns.
Many people associate this disorder with crime. Is that always the case?
Not always, but there is a higher risk of criminal behavior among individuals with antisocial personality disorder. Because they often disregard rules and act without thinking about consequences, they may become involved in illegal activities more frequently than others. However, not everyone with antisocial traits commits serious crimes. Some individuals learn to channel their tendencies into socially acceptable activities. For example, certain competitive environments, such as business or high-risk professions, may attract people who are comfortable taking risks and making bold decisions. Still, the key issue is the lack of concern for other people's rights. When that pattern becomes extreme, it can create serious problems in relationships, workplaces, and society.
Speaking of relationships, how does this disorder affect personal relationships?
Relationships can be very challenging for individuals with antisocial personality disorder. Because empathy and emotional connection are often limited, they may struggle to build trust or maintain long-term relationships. Some individuals may appear charming at first and easily win people over. They might be confident, persuasive, and socially skilled. However, over time, their behavior may reveal patterns of manipulation, dishonesty, or irresponsibility. Partners or friends might eventually realize that the person frequently takes advantage of situations without considering how others feel. This can lead to broken trust, repeated conflicts, and unstable relationships.
Can people with antisocial personality disorder recognize that they have a problem?
That can be difficult. Many individuals with this disorder do not see their behavior as problematic. Instead, they may blame others for their difficulties or view rules as obstacles rather than guidelines. Because of this, they rarely seek out professional help on their own. In many cases, therapy begins only after legal issues, family pressure, or workplace conflicts force them to look into their behavior more seriously. Even then, motivation for change can vary widely. Some individuals may become more willing to work on their behavior if they start to experience serious consequences in their lives.
What kind of treatment options exist for this disorder?
Treatment can be challenging, but it is not impossible. Psychotherapy, especially long-term therapy focused on behavior and decision-making, can help individuals develop better impulse control and improve social awareness. Cognitive behavioral therapy, for example, helps people look at their thinking patterns and understand how certain thoughts lead to harmful actions. Over time, therapy can encourage individuals to take responsibility for their behavior and learn healthier ways to interact with others. In some cases, treatment may also address related issues such as anger management, substance abuse, or impulsive behavior. However, progress often takes time. Personality patterns develop over many years, so changing them requires patience, consistency, and strong motivation.
Can people with this disorder improve their behavior as they get older?
Yes, in many cases, symptoms can become less intense with age. As people grow older, they may naturally slow down their impulsive behavior and gain more life experience. Some individuals learn from past consequences and begin to adjust their actions. Responsibilities such as work, family, or long-term goals can also encourage more stable behavior. Over time, some people develop stronger self-control and become more aware of how their actions affect others. However, improvement usually depends on whether the person is willing to work on their behavior and stick with positive changes.
There are many stereotypes about people with this disorder. What is one misconception that people should be careful about?
One major misconception is that everyone with antisocial personality disorder is violent or dangerous. While some individuals may behave aggressively, many do not fit that extreme stereotype. Another misunderstanding is assuming that people with this disorder are incapable of any change. Human behavior is complex, and many individuals can learn new coping strategies over time, especially if they receive appropriate support and guidance. It's also important not to casually label people as having this disorder just because they behave selfishly or irresponsibly. A true diagnosis requires careful evaluation by mental health professionals who examine long-term patterns of behavior.
What is the most important thing listeners should understand about antisocial personality disorder?
The most important thing is that this disorder involves long-term behavioral patterns that affect how a person relates to society and other people. It's not simply about being rebellious or difficult. Understanding the condition helps people approach it with awareness rather than fear or oversimplification. At the same time, it reminds us how important empathy, responsibility, and respect for others are in maintaining healthy relationships and communities. When people learn more about personality disorders, they can better recognize complex behaviors, look beyond stereotypes, and support healthier ways of interacting with others.
You mentioned understanding the condition instead of relying on stereotypes. How can society develop a more balanced understanding of antisocial personality disorder?
Education plays a huge role. Many people form their opinions about psychological conditions through movies or sensational news stories. These portrayals often focus on extreme cases, which can create the impression that every person with antisocial personality disorder is dangerous or violent. In reality, mental health conditions exist on a spectrum, and individuals may show different levels of symptoms. A more balanced understanding begins when people look into reliable information and learn how personality disorders actually work. When psychologists study these conditions, they focus on patterns of behavior, emotional responses, and long-term development. This approach helps society move away from simplistic labels and start recognizing the complexity of human behavior. Another helpful step is open discussion. When mental health topics are discussed calmly and responsibly, people become less likely to jump to conclusions or judge others based on stereotypes.
Many listeners may wonder how to deal with someone who shows strong antisocial traits. What advice would you give?
The first and most important step is setting clear boundaries. People who display antisocial behaviors may sometimes try to push limits or manipulate situations to their advantage. Having firm boundaries helps prevent others from being taken advantage of. For example, it's important to communicate expectations clearly and remain consistent. If someone repeatedly breaks agreements or behaves irresponsibly, others should avoid making excuses for that behavior. Instead, they should calmly stand their ground and reinforce the boundaries they have set. At the same time, it's helpful to avoid unnecessary confrontation. Arguments can sometimes escalate quickly with individuals who struggle with impulse control. Staying calm and focusing on practical solutions often leads to better outcomes.
That sounds challenging, especially for family members. How does this disorder affect families?
Families often experience significant stress when a member shows antisocial traits. Parents, siblings, or partners may feel confused about the person's behavior, especially when it involves repeated lying, rule-breaking, or lack of responsibility. Family members might initially try to cover up problems or protect the person from consequences, hoping that things will improve. However, this approach can sometimes make the situation worse because it prevents the individual from facing the results of their actions. Over time, families often learn that the most effective approach is to encourage responsibility while also protecting their own well-being. This might involve seeking professional guidance, joining support groups, or learning communication strategies that reduce conflict.
Earlier, you mentioned therapy. What challenges do therapists face when working with individuals who have antisocial personality disorder?
One of the biggest challenges is motivation. For therapy to be effective, the individual usually needs to recognize that change is necessary. However, people with strong antisocial traits may feel that their behavior is justified or that other people are the problem. Because of this, therapists often focus first on building a working relationship and gradually helping the individual reflect on their behavior. Instead of criticizing or confronting them directly, therapists may guide them to look at the consequences of their actions and consider alternative ways of responding. Another challenge is consistency. Behavioral change requires long-term effort, and progress may happen slowly. Therapists often work on improving impulse control, emotional awareness, and decision-making skills step by step.
Are there warning signs that people should pay attention to during childhood or adolescence?
Yes, certain patterns during childhood can signal the need for early intervention. Persistent aggression, repeated lying, serious rule-breaking, and lack of remorse after hurting others are behaviors that may require professional attention. It's important not to panic if a child occasionally misbehaves. This is a normal part of development. But when these behaviors appear frequently and continue over time, it may help to seek out professional advice. Early support can make a significant difference. Teaching children emotional regulation, empathy, and problem-solving skills at a young age can help prevent more serious behavioral patterns from forming later.
Does culture influence how antisocial behavior is interpreted?
Culture can definitely influence how behaviors are perceived and judged. Social norms vary between societies, and what is considered acceptable behavior in one culture may be viewed differently in another. However, antisocial personality disorder is typically defined by behaviors that consistently violate basic social rules and harm others. These patterns, such as repeated deception, exploitation, or aggression, tend to be recognized as problematic across cultures. Still, understanding cultural context helps professionals take a closer look at behavior, rather than making assumptions too quickly.
Some people are curious about the difference between antisocial personality disorder and psychopathy. Are they the same thing?
The terms are related, but not identical. Antisocial personality disorder is a clinical diagnosis used in mental health manuals. It focuses mainly on observable patterns of behavior, such as rule-breaking, impulsivity, and disregard for others. Psychopathy, on the other hand, is a concept often used in psychological research. It includes certain personality traits like superficial charm, emotional detachment, and lack of empathy. Not every person diagnosed with antisocial personality disorder meets the criteria for psychopathy. So while the two concepts overlap, they are not exactly the same. Psychopathy is usually considered a more specific and severe personality pattern within the broader category of antisocial traits.
Before we wrap up, what message would you like listeners to take away from this discussion?
One important message is that personality disorders are complex and develop over many years. They involve patterns of thinking, feeling, and behaving that become deeply rooted over time. Understanding these conditions helps people approach them with awareness rather than fear or misunderstanding. At the same time, it's important to maintain healthy boundaries and protect one's own well-being when dealing with difficult behaviors. Learning about mental health encourages empathy, while also reminding us of the importance of responsibility and accountability. By staying informed and open to discussion, society can continue to improve how it responds to psychological challenges and supports healthier communities.